Welcome to Mandel's Pharmacy virtual learning experience. Before we get started, I am going to read this disclaimer that you see on your screen or on the screen. The PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. Again, everyone, thanks again for being here. This is an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your own home. This PharmAssist takes place every Monday at 7 p.m. Eastern Standard Time. Tonight, we'll be providing a live medication instructional program on 3 fertility products, which are going to be Gonalef, human growth hormone, and Cinera, including interactive questions and answers throughout the program. Please join us via Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format. We are joined by various amazing healthcare professionals each week from across the nation to provide you with real-world experience, just as if you're sitting from them at the table of your clinic or your own home. Today, we are joined by Wanda Hofgesang. And yeah, thank you again for your time and interest this evening. And now I'm going to turn it over to Wanda.
Hi, everybody. Hi, Morgan. Thanks for the great introduction. As Morgan said, my name is Wanda Hofgesang, and I am a reproductive endocrinology nurse. I work in a fertility clinic in the northern New Jersey area. I've been in the field for a very long time, and I've been a nurse for a very, very long time. And so it's great to be a part of the My Mandel's virtual learning experience. I think the biggest part of fertility certainly is a lot of learning and teaching on both sides. We learn from our patients as well as they teach us. And we're doing our best here with collaborating with Mandel's as fertility clinic nurses to be able to review medications, because we do find that sometimes that's a nerve-wracking part of a fertility cycle. So it's always great to be a part of the teaching component, because I know for most of us as nurses, that is one of the parts of our nursing job that is most often needed, is to be a really good teacher and help to calm your nerves about anything that you might have concerns about with these medications. So tonight, what you're going to find that we will be doing is we will, as Morgan said, review 3 products that are part of a fertility cycle. One is Gonalef Pen, one is HGH, the acronym for human growth hormone, and the other is Cinera Patch. So we'll do each of those. There will be a video of each of those products that we'll be putting on one at a time. And then in between the videos, once a video has been completed, we'll come back live for you to have a question and answer session with me and Morgan to review any of your questions. And if you can, we want to remind you to keep everything to pretty much a nice generalized product usage. We do find sometimes people might want to ask very particular questions pertinent to their treatment cycle. And we're always going to have to remind you that, we don't take the place of your clinic, your nurse, your physician. They need to guide you with anything that's specific for your medication cycle. So just know we're going to do our best to answer, though, any questions that we can. And really our goal here tonight is to have you become a pro in your injection technique and medication administration. So each of the products, anything that is an injectable, you're going to see an overview of the product as well as injection technique, because we do find that that brings the most stress to our patients, and they just really want to feel comfortable that they're doing everything right. And so we just want to be able to let you know that there's certainly some flexibility with some of these medications on certain parts of it, and we want to help you to ease any of that concern that you might have. So one of the first products we will go over is the Gonalef, but before Morgan puts that on, I just wanted to say that when you do receive your medications from a pharmacy like Mandel's Pharmacy, just know it's always a good idea to be able to take a look at the products and sort of organize them in such a way that you'll be able to put like items together. I know as a nurse and just in general with sometimes situations that come up in life, it's always good to feel somewhat organized. So I do feel that that's helpful, is there's a lot of different medications in that box. So one of the first ways you can feel somewhat comfortable is by organizing your products, maybe by category, like items together. Because you'll find that some things need to stay refrigerated potentially, and some might need to stay at room temperature. And the packaging always lets us know this. So without further ado, what I'll have Morgan do is bring up that Go on the Left video, and then we'll come on back here to answer any questions that you might have about that. This medication video is to show you how to prepare and inject the Go on the Left ReadyJect pen. First thing to let you know is if you are being prescribed the Go on the Left pen, mainly you're using that to help stimulate follicles or eggs, multiple follicles and eggs, to grow throughout your cycle. So Go on the Left is a stimulation medication, and it contains the hormone of FSH, which is follicle stimulating hormone. So that's the big one that's responsible, whether you're doing an insemination cycle or an IVF cycle. It's helping your body recruit and develop multiple eggs. Once again, I always like to ask or mention first, the supplies that are needed for the Go on the Left pen is one Go on the Left ReadyJect pen and one small needle tip that's provided for you with your pen. Your pen will come in a box, a kit of its own, and the needle tips and the pen will be in there as well. Couple little reminders about this medication is this medication is, again, a subcutaneous injection, like some of the different medications for fertility. So it's administered in either the lower belly or the upper top outer thigh area. That's routinely where, I know for me, our clinic, that's where we have our patients injecting. So you always want to follow your clinic and your nurse's instructions, but routinely that medication is administered in that lower belly and those upper outer side thigh area. So that's a subcutaneous shot. It's a little tiny needle. So again, you have an option where you could self-inject this medication or someone could administer it to you. There's no right or wrong. It's whatever works for you that helps you get through your cycle. So don't feel badly if you hear somebody else saying they give their own shots and you're not comfortable. We want you to always be comfortable with what you're doing in your cycle, and for everybody that's different. So whether you'd like to self-inject or have somebody give you your shot, whatever it takes to help you through the process is most important. With your Go on the Left pen, it may come from the pharmacy and it may suggest to keep it in the refrigerator. Based on the manufacturer's description with this in terms of keeping it refrigerated, if you keep it refrigerated, it's good until the expiration date. If you keep it outside of the refrigerator, it's good for the expiration date or 3 months, whichever comes first. So either or is fine. Oftentimes we just tell patients to put it in the refrigerator because then that gives you the whole time frame and you don't have to worry about calculating. It's just good until that expiration date. Can I take it out of the fridge before injecting? And the answer to that is absolutely. You can put it on the counter for approximately 15 minutes or so. It just brings it up a little bit from that refrigerator temperature and makes it a little bit easier, a little less feeling that you might notice when you inject that liquid. Typically this medication will not sting, but you'll feel a little pinch with the needle. And sometimes if that fluid's cool, you might feel that too. So certainly you can put it out on the counter and let it warm up a little bit before you inject. So for your supplies, we have the Go on the Left pen. The first thing we do with that is we uncap this pen. And the next step is, it is sterile, guys, under there after the first time you use it, but it's just the nurse in me always has the habit of whenever I'm poking a needle into a surface, I clean that surface. So I'm cleaning the surface because I'm going to poke a needle in here. And the needle that I'm going to poke in comes with this product. It is a little needle tip. You just remove the little seal and then gently attach it. Don't over tighten because you are going to have to take that needle back off when you're done. So you don't want to over tighten too hard. So you just want to tighten it a little bit. And then next step is going to be to follow your clinic's instructions with your dosage. In here, what you will see is there is a little dial and there are some numbers. There, right now it's on 0. What you would do is you would turn to whatever dosage your clinic tells you. So I'm just going to turn this, and by the way, this dial can turn in either direction. So I'm going to turn this dial and I'm just going to simply set it to a dose of 150. So you might be able to see that in there, that it's a dose of 150. Again, that'll be determined by your clinic. The other thing I'll mention with this just quickly is a lot of times patients say, when will I know if it's empty? When you give a dosage after you inject, the dial goes to 0. When that dial goes to 0, that means that you still have medicine in that pen. So put it in the fridge and use it for your next injection. The goal of this pen nicely is that it's already mixed and it's multi-dosed, and you're going to use it up until you're done. Eventually, what may happen is when you turn your dial to your dose and you give an injection, if there is ever a number that is not a 0 in that window after giving the shot, that's letting you know, hey, I couldn't give you that injection because I'm now empty. So you would discard this pen, open up and get a new pen with a new needle, and turn the dial to whatever dose this one stopped at after you finished your injection. So if it stopped at a dosage of 50, then you would open a new pen and give just a 50 unit dosage. The other thing I wanted to mention is that the pen is multi-dose. The needles are one-time use. You always only put a needle on, give an injection, and discard that needle into your sharps container that will be given and provided to you by the pharmacy. So the pen itself is multi-use, but not needles. Needles are one-time use, and then you discard, okay? For injection technique for this one, like I said, just to show you that, it will go in either the belly or the upper thigh. So just to get our little mannequin here, in the upper belly, lower belly area, not upper belly because we have some muscle up there, and in our upper thigh, outer thigh area because we have some fatty tissue. So we want to avoid muscle. This is a fatty tissue shot. So if I were giving this mannequin an injection in her belly, I would have her possibly lay down like this, and I would administer the needle to go straight in 90 degree this way, straight in 90 degree this way, or if I'm giving it in the side thigh, it's 90 degree this way. So that would be if she were laying down and I were administering. If she's self-administering and she's standing or sitting, she would be in this position. So what we would want to do to get ready is the first thing is uncap your pen with the big cap and save it, but turn it so that the part that's open is facing up on the counter. And then you'll see that there is a green color here on the tip. We get rid of that one. Don't try to put that back on. I've watched patients do that and they actually stab themselves, and I don't want you to do that. So that one goes in regular trash. Save the other one. And then what you're going to do is you have to clean that area of the belly so that it's good and clean for this injection. And just a little key with your shots, guys, and I'll show this with my arm, is when you're pinching the skin for a fatty shot, you want to give a gentle lift. If you squeeze really hard, you're going to bruise. So sometimes when patients come to me with bruising, I actually have them lift gently so that make sure that they're not squeezing so hard. It's just we're kind of nervous, so we squeeze a little harder, and then that can cause trauma to the skin. So it's this one, it's a gentle little squeeze. Again, we do not have to jab this needle. Just place it to the skin, give a little push. That needle goes all the way in. Once that needle's in, then you are going to push on the end of this pen and push all the way until you feel almost the pressure that you can't push anymore. And once you feel that, count to 1, 2, 3 and let go. Then remove the needle in the same angle that it went in, set it down, and put a little cotton ball to that area. Wipe it if you need to. Usually you do not need to Band-Aid these areas because literally the bleeding stops very quickly, and you'll be able to touch the area after you've given the shot because you won't have felt anything other than the pinch of the needle, which is like a mosquito bite, and usually you will not feel the medication going in. Now what I do is I take a look at that dial, and I do have a 0 in my window there. So that tells me that this pen has more medication. So what I'm going to do is I take the cap and I put that needle into that cap, and I give it a little pinch, and I twist that dirty needle off that I used. I discard it into a sharps container that I will have from the pharmacy, and I reattach the pen cap, and the pen goes back into that refrigerator for your next use. So keep in mind, this medication is subcutaneous, meaning it's a little fatty shot in those thigh or belly. It contains FSH, which is the follicle stimulating hormone, which helps your body recruit and develop those multiple eggs, whether it be that you're doing this for insemination or for IVF. Hope this helped you with your Gonal-f, and best of luck with that medication.
Okay, well, that was awesome. It looks like we have some questions. First question is, you kind of touched base on it, but what happens if Gonal-f is left out, or since it's the summer and it gets like, you think it's been left in the sun, what would a patient do if that happened?
The recommendation is, if you can, certainly to keep it when you're traveling or going anywhere, keep it cool. So, you want to try to just put it back, make sure you get it cooled wherever you are. A lot of times patients will ask if they're traveling in the car, they might be traveling for a couple of hours. So I always just say, think of it like your lunch that you could be bringing with you. Put a little ice pack in there, put your pen in there and keep it stored. You don't want to ever freeze your pen, because your pen is water based, so you don't need to freeze it. You just need to keep it cool. So kind of a nice little cool pack in a lunch type pack that's zippered, and you can put it in there to keep it stored. And then again, if you're taking it out to give an injection, you can take it out a little bit beforehand, so it's just not so cool. But you always want to kind of be careful of storing it in direct light, even when it's in the fridge. Keeping it out of direct light, and then making sure that it doesn't freeze. But if you're traveling with it, think of it like your lunch bag.
Perfect. And then what is the actual, you kind of touched base on it, that it helps like grow follicles, but how does Gonal-f actually work by growing? How does it actually grow those follicles?
So Gonal-f contains a hormone of FSH, follicle stimulating hormone. And these are hormones that we have naturally in our bodies each month. And FSH, follicle stimulating hormone, helps our bodies recruit and develop. Typically in a natural cycle, we have one mature egg that we ovulate. And if we get pregnant, we become pregnant. But if not, then we get our next period. So what happens when you're injecting is you're putting a little bit more FSH into the body. And for IVF or for IUI cycles, intrauterine insemination cycles, we sometimes want to recruit multiple eggs. So the goal is to keep you on the lowest dose that your body needs based on your age, diagnosis, and history. But the FSH is what that Gonal-f contains. And what that does is that speaks to the ovary, having the ovary recruit and develop multiple eggs, preparing those eggs for either an egg retrieval or an ovulation to occur, and maybe an insemination. So it's increasing the number of available mature follicles.
Perfect. And what about any kind of side effects to experience, or like what are the most common side effects patients should be looking out for? That's pretty common, or something that maybe not as common?
Okay. Injection site area, you want to look for anything locally to the injection area. You getting any itching, redness, any excessive bruising. So you always want to keep us posted if there's something going on with the actual injection itself, and then we'll troubleshoot that. In terms of just the symptoms you may feel, the medications take the ovaries, and because you're developing multiple eggs, it may enlarge the ovaries a little bit. So most common, what we might feel in that lower belly, in the pelvis, is some fullness, like some slight bloating. It shouldn't be tremendous bloating, but if you get mild to moderate, a little bit fullness feeling, almost premenstrually feeling, like a heavy feeling, that can occur. And you might get mild to moderate cramping. And often your clinic might give you something that you can take, such as Tylenol or extra strength Tylenol for cramping. So there are sometimes remedies. Good fluids, drinking lots of good fluids is good for that fullness feeling that you might get, because that'll help flush a little bit, move that fluids through your body. So the idea is, most often physically what you feel can be the cramping, can be the mild to moderate bloating feeling. You could get a little breast tenderness with that. Sometimes some people feel a little tired, because once those hormones rise, then that's when our bodies can feel some of that. And that's when you could feel a little bit of tiredness, a little bit of breast tenderness. But physically, what you may feel is due to really just the ovaries enlarging slightly for the increased follicles that you'll obtain.
Perfect. And then looks like another question came in, as what if you get a vial versus a pen of the Gonal-f? Is one better than the other? Is there a preference that people have? What's the difference between those?
Okay, that's a good question. Gonal-f, the manufacturers do have a couple different products up there, a couple different varieties or versions of their product. For us as clinics, there really isn't a difference that we see oftentimes, for sure, with responses, etc. What I will say to that most often with the nurses and like working with a clinical pharmacy like Mandel's, we rely on the pharmacies a lot with if you have fertility coverage, they will usually check your insurance and there may be a formulary of a preferred product, simply meaning kind of think of when you go to the doctor, you might have coverage to see any doctor, but you might have what's called in-network doctors. They are in-network for you where you'll pay a little less out of pocket, or you could go to somebody that's out of network and you might pay a little more out of pocket. So if you have a covered product that's a part of your formulary with your insurance, then as a clinic, we usually have no problem with wanting to work with whatever your insurance will cover to give you the least out-of-pocket expense. There are some patients sometimes that may not have any coverage for their fertility medications. And in that instance, we do rely on the fertility pharmacy to provide our patients with, sometimes there might be some best prices or promotions being offered for particular out of pocket when you're paying out of pocket for these medications. So if whichever one might be a beneficial product for you to keep, again, your costs down, then we are okay with that. And we will work with the pharmacies directly on trying to get the right fit for you with the products. But as far as differences clinically and results and responses and pregnancy rates, not usually that we're going to see a difference with that.
Perfect. And I would say I probably would see just working the field, and you probably can agree that mostly I feel like it depends over the vials, but yeah, definitely could just depend on, like you said, pharmacies or what the insurance covers and things like that.
Exactly.
Okay. I don't think I have any other questions. Anything else you want to add to that before we move on?
No, I think we're good with that one for sure.
Perfect. Okay. So it looks like the next one is over human growth hormone. So I'll get that started.
Okay. Hi everyone, the following video for your medication experience through my Mandel's virtual learning experience is for human growth hormone. Human growth hormone will be possibly a part of your fertility cycle. Your clinic will determine for you based on your previous gynecological history, or if you've done any other cycles of fertility treatment, a part of your fertility cycle. Your clinic will determine for you based on your previous gynecological history, or if you've done any other cycles of fertility treatment, it absolutely could be a part of your cycle. So it works in conjunction with some of the other medications that may be a part of your cycle. So it's not a one-size-fits-all that everyone does human growth hormone, fertility clinic, but it absolutely could be a part of your cycle. So the purpose of this video is to help show you how to mix and administer human growth hormone. Come under another name such as fertility clinic. They is another one of the names that you might see this in the packaging like Mandel. As always, there will be instructions on how to store the medication under another name such as medication is another one of the names that you might see this in the packaging. It is a mixing medication. As always, there will be mention that once you mix instructions on how to store the medication of that mixture. Usually, once you receive this medication, injection, and that store it at room temperature. It is a mixing medication, so you'll find that I'll mention that there will always be where you'll be guided how to mix, how to administer, and what dosage you're taking. All of that is the mixture from your clinic. We will remind you. This is just a nice general video in the refrigerator. So there will always be where that medication and you're ready to get started. To mix, how to what you'll find when you get the medication, the supplies you'll be needing are usually you'll have two vials.
I am so sorry to stop the video. Hey, Wanda, real fast. Are you seeing the videos? Actually, are they popping up for you? I have someone said that they might not be seeing the videos.
You'll have what looks like sterile water, just a water solution, but it is a sterile water solution. So these two vials are what you'll need in order to do your mixing. You may receive multiple vials from the pharmacy, and that's determined by your clinic, depending upon how many days they project that you'll need the medication and your daily dosage. You will be ordered the amount of product that you need. And certainly if you ever need to get more, the clinic will advise you how to contact the pharmacy to potentially get a refill of that. So you need your powder vial and your water vial. As far as syringes go, what will be sent to you is you might have this 3 cc, 3 milliliter syringe sent to you, and it may have a longer needle on that. This is typically the mixing needle that you'll be using for the HGH, or human growth hormone. The other needle and syringe that you might also receive may have an orange cap to it. These are typically referred to as insulin syringes because there's a very small measuring thin barrel needle, barrel syringe. And so what you'll find is you're taking a very small amount of liquid amount of the medication. And so you'll need this type of syringe in order to inject. HGH is a what we call subcutaneous injection. So the needle that you'll be using for injecting is going to be rather tiny, usually a ½ an inch in length. And the area of location will be confirmed to inject, but oftentimes at most clinics for this type of shot, you'll be using either the lower belly or possibly the upper top, upper side, outer thigh area. These areas have some nice fatty tissue, and that's the type of injection this is for absorption that works best with the medication. So your first step with any mixing and part of this mixing with your medication step is it's always a good idea to wash your hands. Working with the medication isn't sterile technique, but it certainly is a nice clean technique. So washing your hands before you do the mixing is a great way to get started. The next step is have available, and you might get these from the pharmacy. These are little alcohol pads, but you may also have a bottle of rubbing alcohol and a cotton ball that can be used to help administer when you put this into the skin, or also you'll see that I use it on top of the vial when before I put the needle into the vial. So I'm taking one of these and opening it up. And my next step is going to be to uncap each of the vials, and I'll hear a little snap with that. And after I hear the little snap and I've taken the cap off, I'll just rub the top a little bit with alcohol. Just in case I did not wash my hands, it's a good idea you're cleaning the top of that vial. Even though usually it's sterile under the top, it's just a good extra measure to take to reassure that everything is good to go. The first syringe that we are going to use is that syringe that has the longer needle. Remember, for the HGH, this is a mixing needle, so I don't want you to worry about the size of that needle and syringe. So you open that up. Sometimes it's not a bad idea to just make sure that that needle is secured nicely because it can come off that syringe. So you want to turn it and just make sure it's secured nicely onto the syringe. And we are typically going to be advised by the clinic how much liquid to draw up, but oftentimes with the HGH, what you'll be drawing up is 1 ml, 1 cc of liquid using this syringe. So I'll draw up to the 1 ml. So what I do with that is I'm drawing up an ml of air. I'm going to pull the cap off. Take the vial that contains the water, the sterile water, and I'm just going to raise this so you can see me, but you could keep it on a nice flat surface. Put that needle in all the way through the rubber stopper, the center, turn it upside down, and you can inject a little bit of that air into the vial. If you forget this step, it's perfectly okay. I'm just equalizing any pressure in that vial by doing that little step. And then my next step is to just draw down. There may be some smaller bubbles there. That is perfectly okay. We are just mixing, we're not injecting. So right now bubbles are not an issue for us, but we're going to draw down, lining up that black rim of the plunger to the 1 line. So 1 ml. I might have some extra solution in here. If our clinic tells us to only draw up 1 ml and there's extra, you don't need the extra. You can discard that vial. And then you take that 1 ml and you're going to put that into the vial that contains the powder solution. Let that powder dissolve. It may be very cloudy at first, might be even a little bubble in there. Again, you can keep the needle in there and gently roll. You'll see where mine's a little cloudy here, and that's okay because it's mixing the liquid with that powder. So we let it do its mixing. After it does the mixing, we're going to remove that needle because that was just our mixing needle. We can then put this into our red sharps container. Oftentimes, like Mandel's Pharmacy, they will provide you with a sharps container to keep all your biohazards in. That's anything that's sharp, so we can put that safely in the biohazard container. Now, this one vial, often with HGH, will contain 2 injections. So if you are given 4 vials of medication with 4 vials of water, then just to break that down mathematically, you have 8 injections. If you're given 5 vials, there's 10 injections. If you're given 3 vials, there's 6. Again, the dosages that you need for your cycle will be determined by your healthcare clinic, and they will be able to order for you what you need. So once this has been mixed, I'm now going to use the injection needle and syringe to draw up my dose with my clinic's help and my nurse and my doctor's guidance with my dosage. So for the sake of today's demonstration, what you'll see here is this syringe is measured in units, and there's 100 units in the capacity of this syringe. What I'm going to have you draw up today is 50 units. That may very well be a very similar dosage that you might have that will be advising you to take with your medications. So we have you uncap that needle. Here you don't have to draw up any air. It's perfectly okay with this little needle to just go in through that vial once, okay? And you're going to draw up and pull down to that number 50. And even though that might look like you're drawing up a lot of medication, I just want you to know that with this syringe, even though it looks like a lot, it really is not, because the needle, or I should say the syringe, is rather thin. So it's not a lot of liquid amount that you're taking. So I'm drawing up to the 50 units. If your clinic tells you to take 54 units or whatever that may be, they'll advise you specifically, but this is around the range that you might be advised to take. There will still be medication in this syringe, in this vial. So what you will do is, this is the vial that you would now put into the refrigerator. And then when you take this medication again tomorrow night, you wouldn't have to do the mixing step. You'd be able to simply use your orange tip needle to draw up. So one bottle usually will make 2 dosages of the HGH for you. And so really you're not mixing every night, which is a bonus, but you're mixing one night for 2 doses, and then you'll mix again another vial, because you will usually be on this medication for, an average of anywhere from 6 nights to maybe 8 nights. So that's why you're going to have anywhere between 3 to 4 vials of the Omnitrope or HGH medication. So once that liquid amount is in your insulin syringe, now you're ready to do the injection. I've capped the needle just to keep it safe, so I can put this down for a minute, just to be able to show you guys where the injection areas are that you're going to use. I have a little mannequin here to just show us. It's easier for you guys to see that it's the lower belly below the belly button. And if you have your hip bones where you can feel that, in between those hip bones is where you want to keep the injection. And in this little area here, this is where we sometimes have a little fatty tissue that we're able to pinch. Upper abs tend to have some muscle there, so this is not a muscle shot. It only needs to be going into that area of fatty tissue. Your clinic may also advise you that you can use the thighs as another area. And so if you're using the thigh area, what we're focusing on here is upper thighs where there's not as much muscle, upper thigh area, and you could even use the side outer thigh area. So upper top thigh, upper side outer thigh, or belly. You can choose with this injection to be laying down and have somebody give you the shot. If they are administering the shot to you, the angle of the needle is going to go straight in. So if I were giving a shot to someone in their belly, I put the needle straight in this way. In the thigh, I go straight in this way if I'm at the top of the thigh. And if I'm doing the outer thigh, I go straight into their outer thigh this way. Okay, so it's a 90-degree angle, technically just straight in to make sure you get it into that fatty tissue. If you were to give yourself your own injection, you could sit as I am sitting in the chair, and the angle would be that I'm putting that needle straight into my belly. So I'd be giving the needle straight in this way into my belly. And if I'm doing my thighs are sitting, as this way with my belly up here. Once again, I'm going straight into the thigh and straight into that side outer thigh. The reason you just want that angle is just so you make sure that you get that into the area that you need to give that injection. One other thing that you do with this injection is, because it's fatty tissue, you want to give a little pinch. So I kind of show my arm here just to see that this is my fatty tissue. So I gently want to lift the fat on the belly or the leg and lift it up. I don't have to squeeze very hard because you could bruise with that. So it's just a gentle lift. That's how you prepare the injection area, is a gentle lift. You've got the angle. These are the areas that you can select from, and then you determine who might be giving the shot, if you're having the shot given to you, or if you'd like to self-inject. Today, what I'll just demonstrate to make it a little easier for the video is that I'll show you if you were giving your own injection in the belly. So what we would do is we select the area of the belly first that we're going to give it into, and we clean that area with a little cotton ball doused in alcohol. Our next little step would be to pinch that area. So hopefully, I want to just turn it slightly for you to see this. If I pinch that area of fat, I'm giving a little gentle pinch. I would then uncap the needle. And with that little pinch, what I do is I place the needle gently to the skin, 90 degrees. I put the needle in. This is where I might feel a little mosquito bite pinch. That's very natural and normal to feel that, but it's very gentle, that little teeny pinch. Once that needle is in the skin, I let go of the fat, and then I just simply push on the plunger, and I don't have to go too fast or too slow. I just go in a nice steady motion in. And then once all of that is into the body, in the skin, I then gently pull that needle straight in, straight out. Put a little pressure there. And that will be where we just have a little droplet of blood. Or what you might find is the medicine tries to make its way back out. So you want to keep it into the body there. So you just give it a nice little gentle pressure. Okay. And this would be your injection of the HGH. Once you are done with that syringe that you've just given a shot, you can leave the cap off and then put this gently right into your biohazard container to keep yourself and anyone in your family safe from any of those sharps. And as I noted, the vial that we did mix, we're going to put that in the fridge for tomorrow evening. Before we give the shot, we can take it out and set it down on the counter for about 5 minutes or so, just to let it warm up from that cold temperature. You can take it right out from the fridge, or you can let it warm up. Either way is fine. And then all you would need is one of those insulin syringes to draw up that dosage, because there'll be one dosage left. And then you'll administer the HGH. And it'll be that third night that you'll need to mix a new vial. So remember, you might be anywhere from 6 to 8 days of this, doing one injection daily. But again, the time of the dosage, how much you will take, and where you're going to inject, the clinic will also confirm this with you. But this video is a nice general way to see before you get started, or while you're beginning your cycle with this medication, how that medication is mixed and administered. So we do hope here at the Virtual Learning Experience with Mandel's PharmAssist program that this was a helpful video for you. And from all of us here at the Virtual Learning Experience, we wish you all the very best with your fertility journey and your medication cycle.
Okay, awesome. Okay, so the question is, what is the benefit of using human growth hormone? We know it's kind of new or compared to other fertility medications. So what does it do? Why would someone's clinic recommend it? Kind of give some more information about that.
So with HGH, or human growth hormone, the purpose is sometimes when adding it with like a Gonalef or the FSH products, it's going to hopefully help enhance the outcome of the recruitment. It's not necessarily, why you might be using it is it's not necessarily going to increase the number of eggs, but the goal is, and some of the studies have shown that it can improve the hormonal environment inside or within the egg. So the goal is maybe to increase the quality of the egg that is recruiting. And so since you're recruiting the eggs with the FSH products, such as Gonalef, Follistim, multi-dose Gonalef, the idea there is by adding HGH with that, the goal might be is those eggs that are recruiting, hopefully improving on that hormonal environment within the egg, improving the quality. And if we can hopefully improve maybe the quality of the egg, then potentially we can improve outcome of pregnancy eventually. Is the goal for everybody.
Perfect. And then I think you kind of briefly touched base on it, but usually how long you're on the medication, and is it okay to take with your other meds? And like we talked about Gonalef, could you take those one after the other if that's what your clinic was providing?
Mm-hmm. Good question. With HGH, often you will be taking your other FSH, LH products, maybe such as, like I said, Follistim, multi-dose Gonalef, Gonalef Pen, even Menopure. So you might be taking other medicines that are recruiting the eggs. So often this is added to those medications as well. And usually with the HGH, I know in our clinic, I can only say that, we're not starting it right at the onset. We're letting some of those follicles grow first. and then we add it in. So you might find that you don't start the cycle with it, you may add it in. So oftentimes that could be where you're taking anywhere from 5 to 8 dosages. It could be a little longer depending upon the length of the woman's cycle. But that might be the average, is anywhere from 5 to 8 injections, because it's typically daily, once a day. So you might have 5 to 8 days. And it would depend on whether you're doing your shots in the evening or morning, and the clinic would let you know that. But you would take it usually with your other products, and they can be taken consecutively.
Perfect. And then same kind of questions last, but biggest thing is side effects. Anything to expect with this medication that should be alarming or just normal that you've heard from patients being on the meds before?
Usually, the nice thing about human growth hormone is certainly with any medication or hormones, that could be symptoms or side effects. But because, first of all, the duration is very short, and it's not that you're on this for a very long time. So it's very rare to see some symptoms or side effects for us, because our patients often are not on it for a very long duration. I think in the literature, what you might see is it could be joint pain. It could be one of the more common symptoms that might be noted. And again, that could be for higher dosages and potentially on it for a longer duration. So I would say really for us, it's not often that we're seeing too much with any symptoms or side effects and issues and complaints, because our patients are using a small, lower dosage and are not on it for a very long period of time. So that keeps those symptoms and side effects kind of at bay.
Yeah, I agree. And I tell my patients a lot of times the most side effects, if you're on it with usually in conjunction with other FSH medications like Minipure, Gonalef, those you're going to have more symptoms from than anything you probably would have from the human growth hormone, just again, sort of super low dose.
Exactly.
I haven't really heard of anyone have any complaints with it since we've been using it in our practice as well.
Same. I would say same.
And then some patients, one client or patient said that they heard that the medication can be very fragile as far as like temperature exposure. Do you have an idea of like how long it can be left out? Do they need to be cognizant of how long after they mix it, how long to leave out the medication? Do you have any feedback on that?
I have to say, I think it would be more like what we experienced with our other products. I haven't had too much with our patients. I know issues with their efficacy of the medication, because oftentimes, as you saw in the video, you usually are mixing one vial and then putting it away. So we haven't had, I should say, anything in terms of the length of time people are keeping them out. I don't even know really if that many patients in our clinic are taking things out to warm them up, but we often will tell them, if you're taking something from the fridge and it's a little cooler and you wanted to leave it out before injecting, you're not going to leave it out for an hour, 2 hours, half an hour. Really, probably just 5 minutes or so on the counter is plenty enough. And even that, you can hold that. Another real quicker way to do it is, I'll tell patients, just take the vial and hold it in your hand for that 2 or 3, 5 minutes period of time, because your warmth of your body warmth, and then you'll wipe the top off with alcohol, certainly. But that would help speed up that process, and sometimes not leaving it out and forgetting it. So that's the big issue is, if you feel like you might forget that, then maybe don't worry about, having it have to come out. But if you do have it out, and you're short for time, hold it in the hand, and that would be helpful.
Yeah, totally agree. And I say tell patients, just once, if it's in the fridge, after, you don't have to panic about leaving it out or having a time limit for how long it's been out, but just after your injection, just put it back in. But not to like stress over something so minute like that. Okay, I think that's all the questions I see right now, unless you have anything else, any other feedback on that medication or any other questions that you can think of that might be beneficial?
No, I think we're pretty, the only other thing I might say is sometimes, people might notice that if they're on the HGH, they may have done other cycles before. Sometimes it might be something that's being added if you've done a cycle in the past, and they're really trying to help improve maybe your outcome or improve your response. So that's often what we will see sometimes, is ladies that may have done a cycle in the past, and this is being added as an added bonus medication to kind of enhance that. So somebody that's out there that says, hey, I did IVF before and this is a new medication, that might be a reason why they're doing that, is to kind of do what they can to give you an increased outcome and pregnancy rate here.
Yeah, no, totally agree. Just to try, it's something different, and maybe that difference is what makes it more successful.
Exactly.
Okay, awesome. Well, I think the next thing that you're going to discuss is a snare patch. So I'll get that going.
Hi everyone, this video is to give you some instruction for using a numbing patch that's available to you if you have difficulties with having shots administered and you're very concerned, or sometimes some people have a tough time getting their blood drawn, and this can be a useful patch to have your center call into the pharmacy, and the pharmacy will check and see what your coverage is for it. But the idea with the patch is just to give you another option of something that might help you in alleviating any fears about blood draws or medication administration. So this medication is called Cinera. It comes in a box that will look like this. Oops, pardon me. Let me put it the right way. And then there are, I believe, 10 patches in here per box. Each patch is a one-time use, so you don't reuse the product. Once you apply it, kind of think of a Band-Aid. You apply a Band-Aid and it might get soiled after you discard it. So each patch is a one-time usage patch. And so when you are applying this to have either a blood draw, okay, or to an area that might be getting injections, which sometimes for fertility mainly could be the buttock area. Some people might want to apply it for the little areas, shots that are in the belly or the upper thigh. But once you get the okay and you have a prescription that does get called in for you, what you want to know is, make sure that the skin area that you're putting this on is not having any cuts or any abrasions or anything that's an open wound. You want it to be clean skin, but you definitely want to make sure that you have no cuts or abrasions or anything like that on those areas. So you would clean the skin first and foremost. And what you'll see is the patches come in a packet, and you will open up that foil pouch and you'll remove the patch and place it with the foil side up. What you'll find here is there is a little sticky, there's a little sticky area here that I will pull off, and then there's a harder plastic area. When this goes on is typically 20 to 30 minutes prior to getting a blood draw or getting a medication administered. So you want to apply it to that area. Careful that you don't touch the area that you'll notice that there's some little dots in here where it breathes, the Band-Aid. But once I remove this, like a lot of times even Band-Aids that might have a little bit of medicated Neosporin already in them or whatever, you don't want to touch that area. So same with this, is that you don't want to touch that area. And then you peel it back and off. And so this is the part that's going to stick to the body. And then just for the sake of my demonstration, what I'll do is I'll grab my mannequin that I have. And if we were going to have her, for her muscle shot, utilize this, we would take the foil side down, not touching it, and apply it 20 to 30 minutes before where she's going to get her injection. And she would leave it on, or she would apply it, I should say. She would apply it to that area, leave it on there for 20 to 30 minutes, and then remove it prior to the injection. When you do go to remove this, what I want you to be careful of again is not touching the inner aspect, that silver part. And so in order for that to be safe for you from animals, from other children or anybody, is your packaging. What's nice is you can just apply it to that packaging and then discard. So save the outer foil pouch to be able to utilize that for discarding your patch safely. So there's a bit of numbing cream, lidocaine, there's a little bit in here. And what those, like I said, those numbing agents can be helpful for some people who maybe really have a potential needle phobia, very concerned about their injections, even, might be a little bit of a difficult blood stick. So this is something that you can always talk and discuss with your fertility clinic, your nurse, your team, and let them know your concerns, because I think all of us would agree that we want you to be able to get through your cycle. We want to do everything we can to empower you to feel comfortable. And so if this is something that is going to help you to make that next step and take that next step to the fertility journey, then we want you to know there's some things out there for you that can help. Thank you again, and best of luck on your journey with your fertility cycle.
Okay. I think Sonera patches are the best thing since sliced bread. My patients would probably say the same thing. I think they're great. Like you said, they really help with, especially those, I think those intramuscular injections. But someone asked, why does it heat up, or what does the heat mechanism, what's the purpose of that?
So the increase of blood flow to the area, the warming up of that area is, kind of a little bit of dilating probably of the blood vessels. So that allows for the delivery of the numbing agents. So that's the purpose of you feeling that warmth, is then the delivery of the two numbing agents that are a part of the Sonera are going to do their job and going to create where you'll feel it's an anesthetic. So that's the idea. You won't feel that pinch or feel that needle go in or feel that muscle shot.
Perfect. And does it matter if you keep the patch on longer? Is it better to keep it? I know it's like usually 20, 30 minutes before the injection, but is there benefit to keep it on longer? Or is there a time period where if you keep it on too long, the efficacy won't be as well? The medication won't work as well.
So a lot of times sometimes we think more is better. So there's a reason that they say 20 to 30 minutes, and that's probably through all the research that the manufacturer has done. So you usually want to try to follow the packaging. However, I do know we've discussed this and numerous times, and the company has looked at, if you were to keep it on a little longer, is there harm in that? And there is no harm in that. It'll still do what it needs to do. It won't change the efficacy. The only thing you just want to make sure of is, because it is a numbing agent, like anything, they also will remind you to not have anything put over that area that could cause rubbing, or don't scratch the area, or don't put that area near excessive heat or cold, because remember, you're not going to feel that. So kind of think like when you go to the dentist and you've had Novocaine and they sort of tell you not to eat for maybe an hour or half an hour after you've had some dental work. And the main thing is because you could start to chew down on something on that side, and you'd be chewing on your gut, the side of your gum, and injure it. So same thing with your body part that you're using this for. It's doing its job. It's numbing that area. So more isn't better, but it's okay if it does get left on a little extra. That's not a problem. But you do want to try to follow your manufacturer's recommendation, because they've done studies to determine that. So they know that it works in that 20 to 30 minutes.
Perfect. And then how long does it normally, the numbing sensation usually last for? After you leave it off 20, 30 minutes, take it off, give an injection, how long should patients be to know how long they should feel numb?
Yeah, I think we've talked about it too in the past. I think it's probably safe to say it could be upwards of an hour, especially if somebody leaves it on a little longer. But if you leave it on the 20 to 30 minutes and then you've given your shot, it might start to wear away in 15 minutes. It might start 30 minutes, but probably about a full hour from when you applied it to when you then remove it. That goal should be that you're not feeling that. And you can sort of test it a little bit and make sure, if you're putting some water on it, see that you can feel the sensation of cooler water, knowing that you're turning on cooler water or warmer water, testing it just gently, but probably it's safe to say about an hour or so.
Great. And would you also recommend, if someone just really wants to, icing it off after taking the patch off, or would you recommend just using the Sonera patch and letting it do its thing? Or is it okay to apply heat or cold after taking off the patch?
I would probably be careful to not apply too much of the temperature, because remember, you're going to have a numbness there. So per the manufacturer, they want you to be careful of that due to the numbing. So the Sonera patch should really do its job for you with what you're taking it for. So you want to kind of hold off on that. I would probably do one or the other. If you don't have Sonera patches, that's when sometimes we tell a patient you can do a couple minutes of ice before a shot, and then you could do a little more moist heat after. But if you're using the Sonera patches, like you said, let them do their thing.
Yeah, I agree. Yeah, they work really well. I've actually tried it out before because I was curious, and I didn't feel the injection. Yeah, just to see it. I didn't feel the injection at all. So they really are really beneficial. I feel like, especially if you have a kind of phobia or just nervous about it. Just kind of takes some of that anxiety away. Okay, do you have anything else that you can think of with regarding Sonera patches?
No, I think we're pretty good with that if we're set with our questions.
Yeah, looks like it. Okay. Well, again, thank you so much, Wanda. You a wealth of knowledge. You can tell that you really know what you're talking about, and it's been great to kind of do this PharmAssist with you. And then, yeah, I just want to thank everyone who's joined us to kind of these videos, and just kind of a reminder that all these videos, including other videos, are available on the Mandel's website, their YouTube, also their Facebook page, and then also MendelsClinicalPharmacy.com. So if you joined in late or just want a refresher, there are these videos as well as other videos that have been going on. And just a reminder that we do these every Monday at 7 p.m. Eastern Standard Time. We try to do different medications every week. So if you have a question on other medications, you can join in next week, and those medications might be covered. And we also ask that you invite your friends, anyone going through this, and share these videos. But yeah, until next week, hope everyone has a lovely rest of your week, and good night.
Thank you, everybody. Have a wonderful evening and good luck with your journey.